Hi, I'm Dr. Claudia Kim, cosmetic surgeon here at New Look New Life. Let's talk about something that a lot of men experience but don't always feel comfortable discussing, and that topic is gynecomastia. Gynecomastia is the enlargement of male breast tissue. In many cases, it's a combination of fat, the firm glandular tissue, and sometimes even excess skin. That distinction matters because it directly impacts how we treat it and what kind of surgical procedures are needed. At its core, gynecomastia is usually driven by a hormonal imbalance, specifically a relative increase in estrogen activity compared to testosterone. This can happen at different stages of life. We commonly see it during puberty, with aging, or in association with certain medications, supplements, or with certain medical conditions. In most cases, it's completely benign from a medical standpoint, but that doesn't mean it isn't significant. For many patients, it can have a real impact on confidence, clothing choices, and overall quality of life. When evaluating gynecomastia, one of the first things we look at is whether the enlargement is primary due to fat or if there's gland involvement. If it's mostly fat, we call that pseudogynecomastia. And we can see this in individuals or teenagers that were a little bit heavier when they were younger or even in adulthood. If there is firm glandular tissue, particularly behind the nipple, that's considered true gynecomastia. And most patients actually have a combination of both. We also think about gynecomastia in terms of the severity. So grade 1 is just a small enlargement and there is no extra skin. In grade 2, moderate enlargement, still minimal extra skin. In grade 3, there's a larger volume to the breast with some excess skin. In grade 4, there is a significant enlargement of the breast tissue with almost a feminine chest appearance and extra skin. As the grade increases, the treatment or surgery becomes more involved, and it's tailored to address what is actually present, which is the fat, the gland, and the skin. If the issue is mostly just fat or fatty tissue, liposuction alone can often create a flatter, more contoured chest. However, liposuction alone cannot remove that firm glandular tissue. And in those cases, we need to actually excise or cut out the gland, and it's typically done through a small rounded incision along the edge of the areola, where the scar tends to heal really well and become almost invisible. Now, when there is excess skin, we may need to address that to avoid having that loose or deflated appearance, and there may be a longer incision across the male chest. In many patients, the best results come from combining these techniques. Liposuction allows us to contour the surrounding chest and remove the fat, while that direct excision removes the glandular tissue that would otherwise still remain. The goal is always to create a chest that looks flat, smooth, and natural without irregularities. One of the most important aspects of this procedure is really the surgeon's restraint. Now, removing too much of that tissue can actually create that concave or that crater deformity underneath the nipple, which can be just as noticeable as the original gynecomastia. So the goal is balance, removing enough to achieve that masculine contour, but you preserve enough to maintain a natural appearance. Recovery is generally straightforward. There is some swelling and bruising early on, and patients wear a compression garment to help support the healing and the contouring during recovery. Over time, the chest will begin to settle, and then the final results become more defined. Gynecomastia is extremely common, and it's also very treatable. And when it's treated thoughtfully, it can really make a meaningful difference, not just in how someone feels, but in how they feel every day. I hope you liked this educational video. Please like and give me a follow.